Medical workers of Reddit, what's the dumbest thing you've seen a person do as an attempt to self-treat a medical condition? I used to work in a lab in a hospital in a rural town. I got a stool sample from the ER that was basically a blood clot the size of a golf ball. Sometimes the ER gets mixed up and sends me the wrong specimen, like some kind of body fluid, and labeled it as urine. For example, I called the patient's nurse and asked what the deal was with the patient and if it was really stool they sent up. The nurse I talked to said the patient thought he'd eaten bad pork and to prevent food poisoning, drank a concoction of bleach, rubbing alcohol, vodka, ibuprofen and some Tums. Say what you will, but he didn't come to the ER with food poisoning. As an EMT basic student, I responded to a man who called 911 complaining of an insect crawling up his ear. Upon arrival we ask what ear the bug crawled into. He says his right ear, but keeps complaining about burning coming from his left ear. We noticed his wife standing next to him holding a bottle of insect spray. Upon further questioning we come to find out she sprayed insecticide into his left ear thinking it would flush the insect out of his right ear. I had to explain to her that our ear canals are separated by our brain. In some cases. Not an RN, but my diabetic grandpa used to eat all the bread sugar he wanted, and then eat lemon drops after everything. According to him, the real lemon juice acid would counteract the sugar he had just eaten. He was convinced. The nurses disagreed and fought with him for years, but eventually gave in and let him do what he wanted because he was 97 and the food made him happy. At 97, long-term damage is kind of moot. We are a needle exchange harm reduction station at the clinic I work at. We have IV drug users come in pretty frequently to get their abscesses cleaned out and dressed properly. So one patient comes in wanting to get her abscess cleaned out like many other patients before her. We take her back to her procedure room and get everything ready to start. She has an ace bandage covering up this spot on her arm, so of course we are thinking it's fine because that's better than just letting it be open to the air. She proceeds take off said bandage and exposes not only huge abscess but a 4-inch length of vein sticking out of her arm that is rotting away and drying up. We are like, oh, what's going on here? And she says she took it out of her abscess and left it out because it made injecting H easier. So basically she ran her own IV with a vein she cut out of her abscess. We then called the ambulance. TLDR. Woman came in with abscess. Turned out she cut her whole vein out to make an IV for easier H injection. Holy frick. A friend of mine got drunk at a party and had fricked a girl he'd just met unprotected. After he stumbled home he realized what he'd done and tried to fix the problem by dunking his junk into a cup of Listerine. He's now a pharmacist and very proactive about giving advice to dumb looking teens stumbling around the family planning aisle after midnight. 911 dispatch here. Heard the story secondhand, but kid had a crazy high fever and wouldn't stop crying. Paramedics get on scene, and mom is squeezing a lemon while rubbing it all over the baby's forehead because it's supposed to keep the fever down. Mom was completely at a loss as to why the baby wouldn't stop crying either. It couldn't possibly be the lemon juice you've essentially been squeezing into its eyes for the last 20 minutes. No siree. TRN people have ridiculous number of fever remedies. My favorites are rubbing alcohol over the entire body, which can cause coma, and applying cut onions to the bottom of the feet. A 60-year-old woman self-diagnosed herself with leg cancer and decided to treat it herself by periodically squeezing the cancer out of a centimeter-wide hole in her leg. Yeah, that was a pretty stupid one. Leg cancer. My patient was instilling honey in his eyes to treat his cataracts and glaucoma. What? Yes, he came in for conjunctivitis caused bacteria were having a party on his corneas. Patient comes into the ED with an abscess. Tells us he knew he had an infection and so ate 1.5 pounds of raw steak to get the antibiotics that were given to the cow. I had a patient treating her lung cancer with a sonic emitter. Her argument was that sound waves can shatter glass, so lung cancer wouldn't stand a chance. Well, it wasn't really to treat a medical condition, but I did see a guy get a pneumothorax, collapsed lung, when he tried to pierce his nipple using a nail gun. His aim was off a bit. Diabetic patient. Went to vacation in the Caribbean. Left her insulin on a cruise ship. Hasn't taken any for a week. Gets back to States and Medicaid won't pay for lost or stolen meds. and she refuses to pay for another bottle because she doesn't have any money. Realizes that no insulin equals more sugar in blood. Somehow gets the idea in her head that more sugar in blood means that her blood is now thicker, so she decides to take a bunch of Plavix, warfarin, and aspirin. All blood thinners that cause bleeding, and high doses can and will lead to internal bleeding and death. To thin her blood. I get the story when she comes into the pharmacy to get refills on her warfarin and Plavix and ask her why she needs those early. Told her to immediately go to the ER. I have no idea if she actually did. Plavix. Sorry, bad typo, thanks for pointing that out. And causes blood thinning. I need to proofread more. My college biochem professor told me that warfarin's original purpose was to kill pests like rats by making them bleed out. It's amazing what proper dosages can accomplish. I had a patient come to the ER complaining of severe pain and swelling all down there. On physical examination we noted a really remarkable amount of swelling, and both the internal and external tissues were extremely red and irritated. She was so swollen she couldn't even pee until we put a catheter in. The physician did a pelvic exam and found blisters on her cervix. We asked when the symptoms started. She said, well, it was itching tonight. I thought I had a yeast infection, so I poured a cup of bleach up in there to kill it. But then after a while it kind of started to hurt. Yeah, I bet it did. TLDR. Do not pour bleach into your glory hole. Animal attendant for a vet clinic here. A client came in and had rubber banded their 2 dogs' ball sacks as a way of neutering them. Very bad. They got the idea from how sheep and goats can be neutered. But there is a huge difference between the junk of a sheep and a chihuahua. Both of the dogs had a severe infection and the tissue was completely dead. The treatment for this cost way more than the neuters would have been. Do not do this ever. Had a frequent flyer patient who had psoriasis so bad that he literally had huge scales all over his legs. One day he gets admitted and the scales are gone. He tells me he took a Brillo pad, steel wool, and scraped them all off. Surprisingly it works with no adverse effects and he's still scale free a year later. I have psoriasis severely over 60% of my body. The Brillo pad thing make me cringe, but also makes me wonder. I worked overnights in a Midwesterner and I have seen 2 men try to treat their erectile dysfunction on their own. One man used cork in his urethra and then it dried and cracked like pencil lead and only the 1/4 inch at the tip came out. He had another 3 inches or so all broken into pieces that required surgery to get out. The other man used a clipped off piece of coat hanger to try to keep himself erect during fricking and that also had to be surgically removed. Dudes is weird. Ask for Viagra. An elderly lady brought her husband in with severe diarrhea. She had stoppered his anus with a 2000 rubber cork. He died of sepsis. I'm an RN and at the time I was working in the emergency room. It was fairly late at night and a woman came in with severe T bleeding. Apparently she decided to use a light bulb as a corn cob and got it in, but couldn't get it back out. She decided the best course of action was to hit it with a hammer to break it and pull out the pieces. I wouldn't consider that self-treating, but it certainly was the dumbest thing I've ever seen anyone do. Not a medical professional, but I once shared living quarters with medics at a small outpost in Afghanistan. Whenever they weren't busy, otherwise they'd see as many locals as they could. I'm working in the back room one day when I overhear this little gem of a conversation. Patient, through interpreter, I caught an STD recently during a vacation in Pakistan. Context: the locals tend to look at Pakistan like Americans view Las Vegas, a way to get away from it all for uninhibited hedonism when desired. Medic: how bad are the flare-oops? Patient: pretty bad, but I'm trying to treat it naturally. I lean in at this point, ready for whatever explanation is coming. Long silence from the medic, who is trying to process the situation. Medic: how does one treat a STD naturally? Patient: I'm eating a lot of cheese. Ophthalmologist here. I've had a patient who would re-wet her contact lenses when they felt dry by putting them in her mouth. Ended up with a central corneal ulcer requiring a transplant. I've seen people do this. My mom used to until I was old enough to get contacts and call her out on how seriously stupid it was. This shouldn't technically count, but it's close enough. I know someone that tried to kill themselves by drinking antifreeze, ethylene glycol. She also tried to put the icing on the cake by drinking a handle of vodka. The funny thing about ethylene glycol poisoning is that alcohol is the antidote for it, so she ended up just feeling like crap in the air for a while. I had a friend try to do the same thing. When I explained to him that drinking alcohol was what saved his life that day, he replied with impossible. Alcohol thins the blood, which makes the antifreeze enter the bloodstream quicker. After laughing for a little while, I asked him where he got that information. I wasn't so surprised when he replied with the internet. Self-diagnosis. They were in for a CAT scan for abdominal pain. Patient began to tell me how they were pretty sure it was uterine torsion as they researched it online and they were 110% sure this was the issue. Sorry to tell you, sir, I am 100% sure you do not have a uterus. Should have played along with it and asked if he could have possibly been pregnant. Pour straight bleach onto poison ivy, at the suggestion of a pharmacy tech. I didn't do this to myself. I saw the aftermath on someone. Pharmacy tech here. We are not, by law, allowed to give out medical advice, and with good reason. We don't have the education pharmacists have. If a tech tries to counsel you, don't take it. Perfect example here. GP here. The most outrageous thing I've heard was from a boy who was something like 22 years old. Very poor, illiterate family. The boy had a bad case of tonsillitis and refused to take any meds because all he needed to do was bite the sun. Basically at noon he had to look up to the sun, open his mouth as wide as possible and bite the sun several times so it would burn his tonsils and cure him over the course of a couple weeks. When that wouldn't work, plan B was to do the same at night but only under a full moon. TLDR. Bite the sun and cure you tonsillitis. I work in a retirement home, and I caught one of my residents with a spoon inside her butt. Apparently she tried to cure her constipation by sticking a spoon up her booty and trying to scoop the poop out. To be fair, if you have horrible constipation, that starts to sound reasonable very quickly. I'm an MD. I saw a patient with cancer get convinced by his chiropractor to stop his chemo and just get naturopathic adjustments instead. He stopped his chemo and thought he was getting better because he was no longer getting the chemo side effects. He died. An 8-year-old tripped on the cord of a deep fryer, spilling hot grease on his shoulder and arm. His grandma slathered him in butter to cool him off and draw the heat out. When my medic partner and I entered the house and started assessing the boy, I was saddened and hungry at the same time. The poor kid smelled absolutely delicious. No cannibal. I want no cannibal to be a thing. A tech here. A man came in with his wife because he had been bleeding from his bum. He thought that the best way was to self-anesthetize with alcohol, lubricate the area, and cauterize with a curling iron. He actually got it a fair way up before he pulled it out, judging by how much of his rectum turned KFC. We had to remove about a foot of GI tract due to burnt, scarred tissue. The worst part was that didn't even stop the bleeding, which originated farther up the GI tract than the iron would ever reach. There is also the story about a champagne bottle popping off inside someone, but that's another story. I would very much enjoy that other story. I work at a veterinary clinic and we once had a gruff, old country guy come in with his Australian Shepherd. The dog had a huge hanging growth under his neck that was rubbing against the ground and just looked horrible. The doctor strongly recommended he have it removed, and the owner said he could do it again. Apparently, the dog had a smaller growth in the same spot years ago that the owner removed with a pocket knife and bottle of alcohol. No closure, no antibiotics. We were so shocked. The doctor went on to educate him as to why that is not a good idea. He eventually agreed to let us do the procedure, but man was he a difficult son of a bee. We're still not sure how the dog survived the last removal without any problems. This is the internet. You can say be here. Giving honey to a baby as a cure to diarrhea. Honey can cause botulism in infants under 12 months. This is a common home remedy in some cultures, so hospitals see a lot of this. On every bottle of honey I have ever looked at or purchased, there's a warning that says, do not give to children under 1 year of age. IV drug user sprained his ankle while skateboarding high, but couldn't be bothered to come to the hospital, so he acquires illicit morphine from his dealer and proceeds to shoot it directly into his joint. Hello MRSA septic arthritis. For the non-medically inclined, this is very bad news. MRSA stands for methicillin-resistant Staphylococcus aureus. It is a bacteria that is resistant to penicillins and other antibiotics because of a gene mutation, and can be dangerous in the wrong places. It's not a death sentence like people seem to think, because we have drugs that can treat it, most commonly vancomycin or linezolid, but they are not as effective, because rather than kill the bugs, they stop them from growing and need a competent host immune system to actually clear the infection. Also, if you are allergic or in a place without universal health care, they might not be options. Septic doesn't necessarily mean bacteria in your blood. Septic means a systemic response to an infection or inflammatory process. That's basically what anaphylaxis is. You get a bee sting on your arm, but your whole body nopes the frick out and your blood pressure tanks, leading to complications, like death. Septic arthritis only means there is an infection directly in the joint space. The reason it is so bad is not because the bacteria is everywhere in the body, it's because antibiotics don't penetrate joint spaces very well, so treating it is a B. Not treating it or treating poorly leads to the infection essentially chewing up the joint, so you're left with a mangled locked up ankle. The big risk isn't necessarily death, it's disability for life. It's worse in an ankle because it's such a complex joint that can't be replaced like a knee or hip. There is also the possibility of it spreading to the surrounding bone, but if you've caught it early enough, you're usually okay. Mrsa septic arthritis. Yikes. Each one of those things is pretty awful. All three of them strung together like that makes me pucker. Urologist here. Sometimes doing nothing is the worst thing. I've seen plenty of patients with advanced penile cancer to the point where identifying anything that resembles a dong is impossible. How some people let it get to that stage still surprises me. Dentist here. Patients with acute dental pain holds ibuprofen tablets, or in the crushed form, against the tooth that hurts. All it does is cause a chemical burn against the gingiva. NSAIDs works systemically and needs to be swallowed. Constitutes for probably the most resourceful, instead of dumb. Had a patient who was very self-conscious about the loss of her teeth. Made her own dentures out of cotton balls, the sticks from Q-tips and glue. Could hardly tell they were fake. While working in the ER, an older woman came in and complained of a headache and rectal pain. Nothing too out of the ordinary by themselves, but an odd combination of complaints. A few questions in, we find out that patient has been attempting to treat her headache with over-the-counter ibuprofen. Rectally, she was pretty embarrassed when we told her over-the-counter meds can't be taken rectally unless specified. Had an old farmer come into the ED one day with a severely infected wound on his head. Turned out he had a growth developing on his head for the past few weeks, which turned out to be a tumor. He had been treating it with Roundup, a potent weed killer, because that crap kills everything. Grew up on a farm. Can confirm this is the rural mindset. My uncle had a rotten tooth and was scheduled to get a proper surgical removal the next day, but it was just too painful. In the middle of the night he attempted to remove the rotten tooth himself with a pair of needle nose pliers. He didn't realize that the rotten tooth was very weak, so when he attempted the removal, the tooth shattered. This made him have to get in his car and drive himself to the hospital, while biting down on a blood-soaked cloth, to get much more expensive emergency surgery to remove the shards of tooth. That was truly idiotic. Paramedic here. Responded to a nursing home for diabetic patient. Unresponsive. The nurse didn't keep up with the insulin and gave a tad bit too much, decreasing the PT's blood sugar. Okay, this is fixable. I walk in to see another nurse pouring Splenda down this lady's mouth. She has snoring restorations and the Splenda is just being inhaled into her lungs. It also isn't doing crap for this poor lady because it isn't freaking sugar. After give this lady some D50, IV sugar water, she came to but felt like she couldn't get enough air. She ended up being treated for a few days for pneumonia. I swear, some people get their medical licenses from the bottom of a Cracker Jack box. Love you. If the nurse was a registered nurse, RN, or certified nursing assistant, CNA, this lady was an LPN, licensed to practice nursing I think. I don't know. That's my correction. And I still love you all. I work in therapy. Had a referral for an older gentleman that had a minor surgery. Nurses noted that he was incontinent of bladder. He was 95-ish. No big surprise. Went to get him up for a walk. pull back the covers and notice a large item concealed under his PJs in the crotch area. After some circular talk slowly getting around to bringing up the matter at hand, it turned out he refused to wear adult diapers. He was still a man around town in his mind and had to always look his best for the ladies. Since the whole incontinence thing was bad for his game, he decided the best course of action was to buy extra large underwear and place his member into a urinal and carry the urinal around in his undies. He said he knew when he was going. He just couldn't stop it from happening, so he'd just excuse himself as he was peeing and find a bathroom and empty his secret container. Plus the gal saw the extra bulge and thought it was all him. Jiggity. I loved that guy, he was a very memorable patient. I love old people who are still with it enough to come up with that kind of goofy stuff. And since they're so old, they just don't have any fricks left to give about any of it. This guy slightly burned both his feet while burning leaves. The burns got horribly infected. He knew he needed to drain them. He pulled the toothpick out of his mouth and drove it through the wounds. A used toothpick. He ended up in the hospital, of course. One of my patients had put Nia on his anus and left it on overnight. As one would think, when he woke up he had burns that looked like a pressure ulcer. Instead of coming to the ED right away, he decided he would soothe the pain with honey. When that didn't work, he tried to remove the honey using vodka. Teaching his roommate how to do those dressing changes was the most awkward experience I have ever had professionally. My wife is a physician, and during training she had to remove about 3 feet of crumpled paper towels from a woman's tea. When asked why she had wadded up the paper towel and placed it in her, the woman's response was, "I didn't want my baby to see what the men's be doing down there." Turns out the woman was pregnant and I guess a concerned parent. LOL. Wife told her to use a condom next time. A nurse here. I was working in Tridge. Another Tridge nurse called me over to show me a horribly rotten foot. The first thing I noticed was that there was no detectable odor. Normally the smell is quite pronounced. I wondered out loud why there was no smell. That's when the patient spoke up. She said, "Bleach. I've been soaking it in bleach every night." A friend of mine is a nurse and they had a young girl come in that had severe cramps and abdominal pain. They asked if she had started her period. They thought it might be her first one and that she didn't know what it felt like yet. She explained she had her first period 2 weeks before and the pain had gotten consistently worse since then. They found 11 tampons inside of her. She thought biodegradable meant they dissolved inside of you and hadn't removed them. My aunt dropped off my grandfather Chinese tiger balm for his sore back. She called him the next day to see how he was feeling. I took 2 tablespoons and it just burned my throat. I worked at an OB-GYN clinic for 7 years. One day a girl called and said she had a broken shot glass up her tea. Upon asking how it got there, she said she was using it as birth control. Thankfully it worked because no one that stupid should have children. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.